made, as Dave already alluded to earlier, around whether or not we need to slow down that international recruitment pipeline. The Trust has been supported as an international nurse retention pilot. Turnover for that remains low, albeit with some isolated issues recently at the RLI, and attrition is also lower than predicted. So the key work underway at the moment is an external benchmarking review with the National CNO Safer Nursing Care team, with recommended actions to help the Trust achieve best practice guidelines, and special thanks to Jackie for arranging that. A comprehensive staffing review is commenced in medicine, supported by Jackie, incorporating professional judgment review with ward and departmental managers. Other specialty reviews will follow, and that will be completed by the end of September. An independent birth rate plus review of maternity staffing was commissioned by me in February. It's now been completed, and we're waiting for the report for that. And it'll include the additional staffing to support continuity of care and recommendations from Ockenden. A complete review of AHP staffing has been commenced, and that will be completed at the end of September. HP retention is now starting to feel the impact of the external market pressures caused through additionality, so specifically the additional roles reimbursement scheme, investment posts, and increasing demand in regulated and private sector. There's a local plan being developed, which includes cross-Bay Health and Care Partners review of AHPs. So all of these reports and documents will be available for the new ECN to use as a baseline from which to make our own professional and clinical decisions relating to deployment of key clinical workforce resources, to ensure that we've got the right staff with the right skills in the right place at the right time. The looming issue of age demographic in nursing, particularly at Barrow, is something that we need to get ahead of. In summary, all of the actions underway are described under the next step action section, along with the timescales. It's anticipated that, as I say, the work will enable a new Exec Chief Nurse to bring a paper back to the board by the end of Q3. So I'm just asking that the board notes the content of the paper, agrees to receive the full nursing midwifery AHP workforce review in Q3 from the incoming Chief Nurse, and continue to support the workforce plan that was approved this year, and ensure that we maintain a positive recruitment position. And I have to say, it's quite a unique problem to have in the NHS when you're at the point where you think that your recruitment plans might overstaff you, and we do need to look at the ICS and how we might be able to help there. Thank you.
Thanks, Sue. So to summarise, you're asking us to note the content of the report, approve the plan with the proviso that the incoming Chief Nurse will want to review it in Q3. That seems fairly clear. Jill's put in maybe a separate plan for AHPs. Can I just ask, will this go through our workforce subcommittee?
Yes.
Yeah, so maybe Adrian, you could take Jill's point and discuss it in that subcommittee. Aaron and David.
Thanks, Chair. Yeah, so it's important that we do have a composite view of the professional staff groups that we need to achieve, required standards, whether it's doctors, nurses, AHPs. So our safe staffing view needs to make sure we've got that triangulated lens across those professional groups, which will make sure that that does in the way that Sue's described and Jill's asked for through the Workforce Assurance Committee. This is a report that actually, for me, lays out some of the issues we've got on that governance, assurance and risk. So we're having to build back some things that we'd stood down through COVID, and we need to re-engage with that kind of national agenda on what good practice is around safe staffing, which I'm pleased to see here at board propose how we do that. What I'm looking for from the executive team is a way of sustaining that safe staffing assurance and oversight that informs, operational decisions on any shift, but also gives us some assurance on future pipeline of, the development of our workforce, particularly the professional workforce. And I'm just going to pose the question again, similar to what I did at the IPR. Sue is right. At a corporate level, we are in a position where we have recruited well, and we are now managing through a different kind of issue on securing roles for those that come. But still, when I'm gold on call or walking the sites, we still see on every shift real issues around shortage of the right skills and competencies of staff on wards and departments, and that's been highlighted in the CQC report. So I'd like to ask Sue and Jackie and Dave, through workforce assurance and the professional nursing standards with Shahidul, that we have a little more grit, rigour and granularity around not only the numbers on shift, but the ratios and the skills mix, because I think that is where I would like to see more assurance. So that's an ask from me, Chair, into the assurance groups with the exec leads on the plans as they develop.
Thank you. I'm just, we'll take that through the board, that David and Adrian will look at that in the workforce as relevant. Thank you, Aaron. David, has your hand gone down?
My hand's still up, Mike. We just respond to Aaron there, and of course, one of the things is our establishments, although Sue's kicking off the work to check whether they're right, they also include a certain element of uplift for sickness absence, maternity, etc. But they don't include for sickness absence levels of nurses at 10%, which we're currently running at, which is an added pressure and an added issue on top of all that. So I just think we just need to recognise that, and the availability, of course, does get picked up through the weekly heat map that we take into execs. Just to some assurance back to Jill about the AHP, or the clinical professional workforce. Tonya Crick is going to be doing both of those pieces of work. The bit that's on its own as a UHMB piece, and again you'll pick up from the CQC that there are some issues we need to pick up there, but we're not an island in our own right. We have to understand the market we're operating in. So he's picking up a wider piece of work around resourcing across the whole of the ICP area, and understanding what the needs, what the demands, what the shortages, what the likely growth is going to be, so we can then reposition Morecambe Bay within that as a developer and as a provider and a feeder into the other organisations. So that's a good piece of work that will go to the Bay Health and Care Partners leadership team, but also through to the workforce, the people committee.
Okay, thank you, David. Okay, do we accept the recommendations? Yeah, thank you. I'm conscious of time, colleagues, so for the next item, I am conscious, Sue, this is your last board meeting and it's an update on the final year. We're asked to note the Nursing, Midwifery and Allied Health Professionals report, which looks at the work that the teams have been doing in the final year, last year, and we're asked to note it. I am conscious of time, but I also want to give you the opportunities. Anything you want to say about this paper or you want to bring to our attention? It is a good paper. We've all read it. We recognise and acknowledge and are thankful for the fantastic work the teams have done. But is there anything particularly you want to bring to the board's attention at this point?
Just a couple of things, if that's okay. I think it's first that we didn't do one last year because of COVID. It would have been easy not to have pulled one together this year, but we felt that it would be a disservice to the teams who've worked really diligently and flexibly to deliver our healthcare services over, during the biggest global pandemic of our careers. I do want to thank and recognise the work of the whole team to pull together the information and data, and specifically to Lynn Wire, because she, pulled the majority of this together. And I just want to say that the report is not it's presented not to claim that we've achieved all the standards, because clearly, we haven't, or that we've undertaken every audit and staffed to best practice guidelines throughout the year. Instead, it simply aims to share the fact that despite the challenges, these teams have not only risen to the challenge of caring for critically ill patients at a time when they've been short-staffed, redeployed, concerned for their own friends and families, but like all of the teams that work in our trust, they've also developed some inspirational improvements and new ways of working. So it just aims simply to recognise that, thank the teams for what they've done and achieved through the most challenging year we've ever had. And as you say, I would ask that you note the content, note the context within which it's presented, and if you are happy to accept this draft, we'd like to just tidy it up a little bit more and then make it available for our staff and the public website, hopefully before I leave on the 10th of September. And the only other thing I'd like to do is add my own heartfelt support and thanks to every member of staff, no matter where they work, for what they've achieved. And I've absolutely got confidence in everybody to deliver what we need to deliver given the challenges over the coming year. Thank you, Chair.
Thanks, Sue. I'll ask colleagues, I think we all echo your sentiments, absolutely. Colleagues happy we accept this as a draft and then it will be made into a final draft and distributed? Yep, okay, thank you. Then I'll move on. We've got finance and quality subs update. I'll ask you both. I know Steve isn't here, but I'll ask Bruce or Liz, anything on finance that you wish to bring to our attention for assurance purposes?
I think, Mike, the key issue is about the uncertainty. I think Kate mentioned that we haven't got H2 second half of the year funding yet, and we're trying to plan operationally for activity finance without any details yet, and we won't get the details till the end of September, just before we start H2. Pressures continue in terms of finance, as we've had to find more money for stroke and other services, but overall the deficit is slightly below what we expected at this time. So many thanks to colleagues.
Thanks, Bruce. We'll move on then to quality. Jill?
I just want one update, because I think it was an error on the 3A's paper. What we wanted to say was that the trauma and orthopaedic mortality data showed excess deaths which are above the national and peer average. That didn't come across, and that was what at quality we wanted to alert the board to, that we've asked for a deeper look at. Thank you.
Thanks, Jill. Thank you. And we'll note that and hopefully it'll come back to the board when you've done that deep dive. So thank you. Okay, Colin, as head of governors, I know it's not on the agenda. Any comments you wish to make?
No, thank you, Mike. I know there's not anything on the agenda. I did ask about this, but I have asked for a separate meeting with you regarding what's going on with the CQC report and the amount of questions I'm getting from governors, because I think I would like to pull together an extra Council of Governors meeting, but we're discussing that I think later this afternoon, Mike.
Okay, yeah, and I'll be seeing you this afternoon. Okay, now Colin, is this your last board meeting?
No, I'm not being thrown out just yet, Mike. I think I'll be here on September the 29th, where I will give my last written report to the board. I know some of you might want to get rid of me earlier, but I'm sorry, I've got one more.
Well, I can unanimously say none of us want you to go. Okay, thank you. The rest is attendance monitoring. No urgent business has been brought to my attention, but I'll just check with the board secretary. Paul, anything that's come through for urgent business?
Not for today, Mike, no.
Okay, I'll close the meeting then. We'll meet again at 10 AM Wednesday, the 29th of September. I will close this meeting. Colleagues will be aware that those of you that's in the next meeting, we should have started it at 10:50. So I will ask you, those of you coming into the next meeting, do you want a quick comfort break? Yeah, okay, 3 minutes. All right, 5 minutes. All right, see you in a second. Bye.
Thank you.